my pleasure to do so. I'll be brief here today so we can get to hear from Kelly and interact there. Just a quick editorial comment, though. I want to note on the 10th year university anniversary that it started out, Borsi will remember how many years, but the first few years, this was supported by the VA. Implementation Research Group. Christine Kowalski was really the coordinator, and Borsik and I both helped a lot. And then gradually we took that over when the VA had to do other resources. And either she or David Goodrich might remember other issues or stories that we don't have time, or I won't even remember that going to put into there about that. But I want to acknowledge it. Very briefly, Kelly is both a great colleague. I'll say one word more about that at the end after I do the more formal things. But her position as associate professor in psychiatry at the Dartmouth School of Medicine College. She's also a principal scientist at Dartmouth Health System. She's a co-director of the Dartmouth Center for Implementation Science. And within implementation science, Kelly has a broad interest and contributions there. But again, key focus today, or what we're talking about today, are adaptations. And then the other area that she works very actively in has to do with sustainability, sustainment and sustainability. As I mentioned, she's a super collaborator, and the way most recently, Borsika and I have been privileged to collaborate with her and her colleagues was through NCI Center Consortium of implementation science centers across the country. And actually, this talk grew out somewhat, not solely, but somewhat of a paper that we wrote as part of that consortium that Kelly led. With that, turn it away, take it away, Kelly.
Thank you, Russ, and thank you, Borsika and Kara, uh, for the invitation to present. I'm going to share my slides. Can you see my slides?
Yes, look great.
Great. Okay. So thanks, everyone. Good to be here. I'm really excited to talk with you all today about assessing the impact of adaptations on outcomes and implementation research. This work was really motivated by our group's observations and experiences with this methodological gap between what's been a big focus in implementation science on things like guiding and planning and tracking and reporting adaptations, and really less attention, at least in the literature and in the research talks we see, on how we actually how do we assess whether all that adaptation has an impact. And this is just the talk today I'm presenting has an accompanied a paper. And the ideas here are really just we're just offering ideas about ways to get started with assessing the impact, to think about it, and hopefully to stimulate others' ideas and plans, strategies that they may share for thinking about assessing adaptation. And before I get into my talk, this might be one of the most important things I say today is that my colleague Sarah Malone from Washington University and I we are co-leading the fun run, this year's fun run at the DNI conference. And it's very important that I announce this because Gila Netta from the NCI, who has led this fun run for years, is passing the baton to us to recruit, to engage people in this run. So we're going to do it Tuesday morning at 6 a.m., meet in the lobby of the Gaylord National Resort. Please, if you're interested, sign up for the fun run. If you don't end up making it, that's fine. But we just like to get a count of who's going in. It's really important. There's a release and waiver liability that you sign, and it's helpful if you can do it online. We don't have to do paper copies. So if you're interested, this sanctioned run will be just over a mile. If those of you want to go a little longer, we can probably do that too. But this is just a great opportunity, seriously, to network too with people who you may see in a presentation or read their work. Last year, I think Greg Ahrens was at the fun run, and I was so excited. I had not met him in person, and he's one of my academic heroes, and it was just really fun to get to be in that kind of atmosphere and then go and take care of our business at the conference. So if you're interested, please join us. We'd love to see you. Okay, and so as Russ explained, the work I'm presenting today is really a collaborative effort. I had the privilege of working and thinking with Russ and Borsika and Steve Bartels through our Implementation Science Center in Cancer Control. I was working as the director of the methods unit at the ISC3 at Harvard, the Harvard T.H. Chan School of Public Health, which Karen Emmons led. And so I have two objectives today. I'm going to disseminate our methodological recommendations, and then we're going to ask for your input on thinking about a workshop. So we're going to put a workshop together, and you want to learn more and think more about ways of assessing impact. What would you want to learn about? What would that look like? And we will get into the weeds. As you can see, these are lovely buttercups behind my first objectives, which are also considered weeds. I think that it's really important when we start talking about assessing impact that we spend time in the weeds and we think about how those weeds can advance our science. And so we'll do a little bit of that in the time we have together today. So here's the definition of adaptation that our group adopted, and this was really influenced by the work of Borsika and Russ in thinking just a simple definition of adaptation as planned or unplanned changes to an intervention or an implementation strategy. Adaptation can occur before, during, and or after implementation. And if you really want to think more about adaptation and the guiding and tracking and reporting of adaptations and that piece, here's a reference to a talk that Borsika gave. It was an excellent presentation last week on that topic. So check that out if you want a background into adaptation more broadly. So the gap that we really were challenge to think about and address with our recommendations was this idea that we've done a lot of work in guiding adaptations, a lot of work, including that led by Borsika and Russ on tracking adaptations. And of course, there's the frame for reporting adaptations and other frameworks. And so what about assessing the impact? What does that look like? What are examples of that? What are ways we approach that? So here are in a nutshell, are 4 recommendations that I'll go through each of them with you throughout the presentation. So they include, and you could do these in other orders. This is not an order or steps you need to follow. These are recommendations we have. Maybe you mix up the order. It's, depends on the type of research you're doing. So we want to think about defining the construct of adaptations and identifying the type and timing of the adaptation. We want to think about identifying and specifying the expected proximal and distal outcomes of your adaptation. We want to think about the range of study design options. And what we'll emphasize in this presentation is choosing the design that not only is best suited to answer your research question, but maybe is the most practical and feasible. And the design that you can do now, maybe you can't or don't have the capacity to wait 2 years for a grant to be funded. Maybe you build on the existing research of your team. We'll show you some examples of how that's done too. So really think through what's the range of study design that you would use to assess impact. And then, of course, consider, well, what's the data that's available to you? What data will you need to collect? And then what's the goal? What are the goals of collecting all that data or analyzing that data? What are you trying to understand or accomplish? So our first recommendation, the idea of defining the construct of adaptations and identifying the type and timing of adaptations. So I thought it would be helpful to present this recommendation in terms of what are the challenges we experience, and then what is our group recommending, ways to address the challenges. So one challenge is that I experience in my work, I experience it when I'm mentoring early career investigators, taking on the work of adaptations. It's like, man, there are so many characteristics of adaptations to consider. So many things I could document, so many things I could characterize. If I'm interested in assessing the impact, what do I do? Do I just take a comprehensive approach and document everything? Do I focus? And so the one thing that may be helpful, a couple things, is to think about, okay, well, which adaptation constructs will be documented? What do you have the capacity to document? What do your partners have the capacity to document who are telling you about adaptations, or if you're observing adaptations? And then thinking about the adaptations, having a hypothesis about the relationship between your adaptation and your outcome that's testable. So what's the relationship you're hypothesizing between an adaptation and an outcome? And that can help you think about focusing on even defining what you mean by adaptation in the construct of adaptations. So another challenge may be that we're just not sure how often to document adaptations and how to document them. You see a lot of examples in the literature. You see people doing longitudinal tracking. You see people doing one-time interviews of adaptations, collecting qualitative data. You're just not really sure. Well, one thing we can do is define the frequency and method of tracking adaptations based on your research question. So going back, what's your research question about these adaptations? What's the question? And then thinking about what and how much and when data on adaptations we really need to collect in order to answer, explore, investigate that research questions. And what's feasible and acceptable to partners in terms of the documentation of adaptations. And then another challenge is that we have a large number of adaptations documented, and we need to decide which to prioritize in assessing impact. So here you may have had the luxury of documenting a lot of different types of adaptations, characterizing your adaptations, and it's like, well, which of these am I focusing on when I'm assessing the impact? So one idea is to think about distinguishing between adaptations that are expected to impact the function. So the function, the fixed aspect, what's the purpose of your intervention? What are you trying to change? Versus the form, those variable aspects, those parts of the intervention that could be changed without impacting the function. And so maybe you're looking at an adaptation to the function, and that's really important. You're expecting that's going to have a major impact on an outcome because now they're changing the function. Or maybe it's the form, but it's a major change. So it's not the minutia or the more detailed part of the form. So thinking through we're going to know best as the lead investigators, what's the research question? What's the outcome? What are we hypothesizing with the relationship with the adaptation and the outcome? What are they adapting? Prioritizing adaptations expected to have a major or significant impact on adaptation. So be thinking about that. What does that mean in our work? Okay, so the second recommendation is to identify and specify the expected proximal and distal outcomes of adaptations. So in our paper, we have generated some additional files to be helpful. They're meant as practical tools to help investigators thinking through this assessment of adaptations. So files 1A through 1AB will help us make decisions about adaptations and outcomes and make specific hypotheses. So this is our additional file 1A, and this provides recommendations in a template to help us conceptualize, assess, and report both proximal and distal outcomes for adaptations to interventions and strategies. So we can think through what is the outcome of the adaptation? Do we think it's going to be intended? Is it a possible unintended outcome? And is that unintended outcome going to be positive or negative? Is it an equity relevant adaptation? So equity relevant adaptations are defined as adaptations that explicitly aim to reduce health disparities by ensuring that interventions are accessible, acceptable, and effective for populations that experience disproportionate burdens of disease. So with thinking through, it was really helpful for me when working with Russ and Borsika and Steve on this um, this template here, it's like, yeah, there probably will be more proximal outcomes. So you're adapting something. There's probably going to be something that's impacting first, and then later on, perhaps, or maybe just a proximal outcome. And you're really not sure what it would do down the road, but you can identify a proximal outcome. And thinking also about the mechanism through which the adaptation impacts an outcome. So, what is the change that an adaptation is bringing to impact an outcome? So, helpful to think about the type and timing of our outcomes. And then is it an intended outcome? Is there possible unintended outcomes which can happen with our adaptations? And when we're using this template, the idea is not to fill out every cell for every adaptation. That's not going to be likely. A lot of these will probably be blank, but it's just thinking about which cells in this template are most relevant to the research you're doing, to your research question, and the hypotheses you have about the relationship between adaptations and your outcomes. And here's an example of a table that's completed of the template I just showed you, where the example is the study team received feedback from community partners that they really needed culturally tailored recruitment letters over recruiting patients in the patient portal. So the feedback was this patient portal messaging, it's not reaching the community of interest. We really need to develop personalized, culturally tailored recruitment letters. And then the primary, so you can see that was example 1, adaptation to recruitment materials, tailored language for recruitment letter to increase cultural appropriateness for the priority community. They expected to have an intended outcome. They expected to be equity relevant. In terms of the mechanism, the hypothesis is that increasing cultural appropriateness of the recruitment letter increases trust and interest from community members from the priority community. And then that in turn will increase a proximal outcome of reach in terms of the number of community members from the priority communities enrolled in the study. And then that is expected, that adaptation is expected to have a longer term, more distal outcome of a more diverse sample reached across the study. And you can see they didn't have hypothesis about these other cells, and so they put their NA in here, just left them blank. They didn't have specific service or person level outcomes that they were thinking about. It was mainly in terms of the proximal and distal outcomes of reach of this example adaptation. If you look at the example of this table that's in our paper, you'll see another example, example 2. So there are a couple of examples, and in the template I just showed you, the idea would be that for each of your, and again, probably not every adaptation, most likely in your study, but the ones that you think are going to have really an impact on your outcomes, that you would do this exercise for those adaptations. And it's meant to really help us think through then the hypothesis that we may look at when we're looking at the impact on outcomes. And so this file goes with the template I just showed. And this idea here is to really help us think about the data that we would need to have on the outcome to be able to examine the relationship between the adaptation and the outcome. So thinking here about what you have your impact one from the file, and you thinking through for your first adaptation, well, what data will be collected from whom, when, and how about this impact outcome? How, when, and how frequently will this outcome impact be analyzed? So it's really getting into the weeds and thinking about, okay, you just said this outcome of interest in this one was we say our outcome was increased number of community members from priority communities enroll in the study, and then our more distal outcome of a more diverse sample reached across the studies. So it's like, okay, how are you going to, what data you're going to be collecting to be able to look at that? And so you can see here in this example that's in the paper where the investigators say, okay, for our adaptation to recruitment materials, we are going to, for the proximal outcome, look at study registration records to document recruitment, including the number and key characteristics of community members who enroll in the study. The data will be collected throughout the study recruitment and enrollment period. The research team will conduct a weekly review of recruitment of priority community member characteristics by examining descriptive statistics. It's their prox. That's how they expect that they're going to collect this data to look at the proximal outcome. And then how are they going to know if they've if they've had an impact on this more distal outcome of reach, which is the ultimate goal of having a diverse sample reached across the study? What data are they going to use for that? Well, their participant data will include key characteristics of the community members, documented using study registration records. At the end of the active implementation phase of the study, participant enrollment numbers and their characteristics will be reviewed as descriptive statistics. So it's a lot of information in here and a lot of detail, but that's what we're going for. We're trying to really use these templates to help us think through these connections between adaptations and our outcomes, and then get really granular and like, okay, this is our outcome. Let's think now. Let's plan ahead in terms of how we're going to collect this data. Is it feasible for us? Is it feasible for our partners? Is it feasible for the health system we're working in, for example? Or they say they need to get these study registration records from the research team. Can the research team produce them, et cetera? So it helps us think about how we're going to really assess these impacts by being very specific about the outcomes and how the data will be collected and the type and timing. Okay, recommendation number 3. So we recommend that study teams consider all possible study designs and select the design that's best suited to answer the question and that's most feasible given the technical constraints of the study and acceptable to research partners. So an adaptation study could be a primary standalone study. It could also be an add-on to an existing study. So there's not, this is when we were writing this paper and brainstorming and having our meetings, it was like, look, there's a range of study designs we use in implementation research, and we really want to leverage what we can. So sometimes we'll do an experimental design, maybe where you're randomizing organizations or patients to an adapted versus unadapted version of an intervention. Sometimes we'll have an observational study where we're conducting mixed methods and we're really just trying to understand something about the relationship between adaptation and an outcome. It's not an experimental study, but we're adding on to an existing study, and that may generate hypothesis for something we do down the road that's experimental. It's really thinking about the range of study designs and how to leverage them to help us advance our understanding of the impact. And this was absolutely a labor of love, this additional pile 2. This is pages and pages of study designs, you name it. It's hopefully in there. And I'm just showing you blocks, cells for the that don't even cover the types of our CTs. But you can see here, starting with experimental designs, what our team did was go through the different types of study designs as much as we could, as much as possible, and just really remind ourselves, like, what are the how do we operationalize these study designs? Okay, what's a randomized controlled trial? And then thinking about their advantages and key considerations and challenges. And this was something that I know Russ really pushed me on, is not in general. We could use a study design textbook to learn to go back and reference what are these advantages and disadvantages or challenges in general. But when we think about in terms of studying adaptations, what are some advantages and key considerations and challenges. And so we went through took us probably a few months to get this table to the point where we were satisfied with it. But it's meant to help us when we're designing these studies, or we have this adaptation data collected in a study, go through, this table and thinking through what am I getting into in terms of the advantages and challenges. And then we also went through the existing research literature to identify some examples for each of these study designs of either studies that had used the design, or a study that to study adaptation, or a study that we did a bit of adapting and based it on for the example here. But this is really meant to help us think through the different study designs, how they could be used for adaptation, and advantages and challenges. So check this out if you are interested and think this may be helpful to you. And then this figure we developed as a starting point to help guide teams towards thinking about the design we'll be using to assess impact of adaptations. And there may be different ways of putting this decision guide together. You may have another perspective. This is a starting point we thought could be helpful for us. So thinking first about whether you plan to randomly assign participants or groups to the adapted evidence-based intervention or strategy to test. Are you looking at testing cause-effects relationships between adaptations and outcomes? Yeah, you're going to look at, these are possible study designs, so randomized controlled trials, different types of them. You're interested in this cause-effect relationship, getting at that. But maybe you're not interested in, you're interested in cause effect, but you're not going to have random assignment. So maybe you're using a quasi-experimental design. And maybe you're not interested in cause and effect. You're looking at associations. You're trying to generate some hypothesis. And then maybe you're wanting to use observational studies for that. And then, of course, alternative and complementary study designs used could be qualitative methods or mixed methods. We did want to emphasize that before designing an entirely new study, is consider whether there is an opportunity to add a secondary low-cost study of adaptations to a study that's designed for another purpose. And I'm going to, my next set of slides, I'm going to get into some examples of adaptation research that's looked at the impact of adaptations on outcomes. And I'll give you an example from my own work of doing exactly this. And so our research team at Dartmouth has been engaged in a 20-year community partnership where we've been developing, testing, and implementing an evidence-based lifestyle intervention InShape that has been shown to significantly improve cardiorespiratory fitness and weight loss among individuals with serious mental illness. And this is a very important intervention because individuals with serious mental illness die an estimated 10 to 20 years earlier than the general population, and this is primarily due to cardiovascular disease that research has shown can be addressed with changing lifestyle behaviors. So InShape is really an important intervention in our arsenal of health promotion programs, and remarkably, in and outside of research contexts, it's been implemented in over 80 community mental health organizations across the U.S. And I've been working with this team for 15 of the 20 years and doing a number, when I was reflecting on it, it's not just the paper I'm going to talk about in my next slide, but actually several different adaptations of the InShape program, including I had an internally funded K award that focuses on a family component for InShape, an adaptation to the intervention. That led to an R01 where I looked at adapting principles of InShape for younger adults with serious mental illness who are newer, earlier on in the course of their mental illness, and trying to help them with their fitness and weight loss at that stage in time. And then our adaptation study that we've shown a couple times over the past couple years, where Steve Bartels, who was the PI, he was the lead on a national Type 3 implementation of InShape, which interestingly, the goal was to implement InShape with high fidelity. So the fidelity was the primary outcome. Implementing it in behavioral health organizations, testing a learning collaborative versus technical assistance, fidelity was the main primary outcome. And we observed through the course of being involved in these learning collaborative sessions, which we were observing, we weren't leading, but we were listening to them and learning. We would hear the organizations during a learning collaborative session where fidelity was discussed, where components were reinforced. They would share their adaptations over and over again. And we were like, this is so interesting. They're just, they're in the real world implementing and they're adapting, and what's going to happen to our fidelity outcome, but also very interested in the changes we were making. And so we worked with David Chambers, who's now at the National Cancer Institute, who was at the NIMH at the time, and told him, like, this is what we're observing during this study. And he said, document, can you document it? Can you systematically try to understand how these adaptations may have an impact on your outcomes at the implementation outcomes, but also the person level outcome of cardiovascular disease risk reduction. And so we had a supplement to the larger Type 3 trial where we interviewed 37. I interviewed 37 organizations who are participating in that study at the end. So it was the very end of their participation. They're done, 18 months of the Learning Collaborative, and asked them, what were they implementing? What was the model? What did InShape look like? What adaptations did they make? And we documented the number of adaptations. We characterized the type of adaptations as fidelity consistent and inconsistent. And really important here was it wasn't according to the research team. It was having the model purveyors. They rated the adaptations as fidelity consistent or inconsistent according to their view of adaptation. And so one of our most unexpected findings from this study was that most organizations adapted InShape to better fit local and context and needs. And that was several years ago. So at the time it was unexpected. It's like, wow, adaptations are happening a lot during this high fidelity implementation strategy. And we learned that the greater number of adaptations overall was associated with significantly higher odds of cardiovascular disease risk reduction. So it's like, oh, okay, adaptations are leading to a change. Or I can't say that, they're associated with a change in risk reduction. And so, but interestingly, the fidelity consistent adaptations were not significantly associated with cardiovascular disease risk reduction when we started to look at the type of adaptation. The majority of adaptations were rated as fidelity inconsistent by the model developers. And the significant positive association between the number of fidelity inconsistent adaptations and cardiovascular risk reduction. So that association was explained by the positive association between the number of fidelity inconsistent adaptations and cardiovascular risk reductions. And interestingly, when you looked at that, the main driver of what this finding, it was an adaptation to the form that would make sense if you were interested in better fitting the model into a community setting. And so we were just really surprised by these findings, but probably the most interesting and surprising thing that happened from the study was that the model developers have since shifted the way that they're operationalizing core components of the model to embrace what were once considered fidelity inconsistent adaptations as now allowable adaptations. It's a support sustainability of InShape. So we're out in the field now with a new R01 study following up, looking at adaptation and sustainment 8 to 10 years after this initial Type 3 trial. And it's very interesting working with the model trainers and how their own view on the model has evolved, in part because of the data, because looking at these associations and finding out how people in the field are making these adaptations to improve the fit. So Example one, again, add-on study where we assessed impact of adaptations during a prior trial that my colleague was leading, was able to do this in a real kind of low-cost way and show some important associations that ended up being preliminary research for work we're doing now. Okay, so another example, this is a experimental study, article in Press and Implementation Science. You may have seen this already. It's really an interesting read, kind of complex. Lots going on. It's a type 2 hybrid trial. But what I'm going to show you today, most relevant to what we're discussing, is this. The title, anyways, is a randomized trial of adapted versus standard versions of a behavioral sleep intervention that was implemented in community mental health centers. And so the team had 8 Californian counties were cluster randomized to standard treatment or an adapted version designed to improve the fit of the intervention to CMHCs. And so it's interesting if you read the paper, they adapt, it looks like they're adapting not only the parts of the intervention, but also the context to better fit. There's some adaptations to the context. And so in terms of the intervention, their standard intervention involved an 50-minute weekly session treatment. The adapted version is 4 20-minute weekly sessions. And they say they have the same 4 cross-cutting modules. If you're interested in more details about their adaptation, like I was, they have some supplemental reading in there that actually explains a lot of their adaptation process, which is quite interesting. Recommend taking a look at that. And so what they found was when they combined adaptation and standard treatment, that treatment was associated with an increase in post-treatment improvements in sleep disturbance, sleep-related impairments, and functional impairment relative to they had a usual control delayed treatment group. Okay, fine. They combined, when they looked at the data, and they combined those treatments, a treatment, it was associated with improvements compared to the usual care delayed treatment. Interestingly, they had an exploratory hypothesis about the relationship between the adapted versus standard version, and they found that there was no significant difference between adapted and standard treatment on sleep and or other patient outcomes. Okay, so you might think, oh, no impact. We assess the impact. No impact. There's no impact. However, the more I was reading this paper and thinking about the lens that we use for assessing impact, it became more and more interesting. Because it's like, well, first of all, you'll see that they had real challenges with recruitment for the standard treatment. So there were a lot more counties agreed to participate in the adapted version, maybe because it's half as long to administer. Maybe we can imagine why the burden's lower, and so they're really not balanced in terms of even being able to look at differences between these groups, which is interesting. And then they report more attrition among patients in the standard than the adapted version, which seems really important if you're trying to reach and administer a treatment to people to help them with their sleep. And so they report that the larger number of providers and patients in the adapted treatment was driven by stronger recruitment in the counties cluster randomized to that condition, and perhaps also provider and patient preference for the shorter fitted approach as compared to standard treatment. So it just made me think about even the complexity of when we talk about assessing impact. You might read the headline in the abstract and stop there, like, oh, there's no impact. Adapted versus standard, wasn't that in terms of health outcomes or clinical outcomes, wasn't more impactful. But then you think about, well, what could other ways, implementation outcomes, even bringing those in terms of the reach or the adoption, if we brought those in as outcomes, looking at assessing our impact, would those be different? So really interesting article to think through how we're assessing impact. So one more article. This is a recent paper where, based on a mixed methods study of the dynamic adaptation process to address LGBTQ plus health equity in New Mexico high schools. Um, and so in this version, the part of the study they're presenting to us in this paper, I'm showing it because it's a nice example of the integration of quantitative findings with qualitative findings and trying to make sense and understand perhaps the impact of an adaptation. So you can see here that the goal in this study was to implement these evidence-informed practices in schools, including a practice that would facilitate access to providers who are not on the school property, who have experience providing social and behavioral health services and sexual and reproductive health services to LGBTQ plus youth. So they found in terms of the quantitative finding, there was a significant increase in adoption of practices for facilitating access among the schools that participating in this dynamic adaptation process. And then in their qualitative findings, they note that an adaptation within underserved communities, the implementation resource teams organize LGBTQ plus specific professional development for local providers. So they note this as an adaptation. They had this specific development to help these providers understand this group, this population served, and that may have been, they're noting as a reason, contributor to this increase in the adoption of those practices. You might take this study and think through, well, what if I thought through, are there more proximal outcomes I could have looked at here? More, is the distal outcome adoption, but something that was between, maybe a mechanism between adaptation and adoption that I would have liked to seen examined, or that I would examine if I was a part of the study team and did an add-on study. So another great, I think, example of looking at this integration, a mixed methods integration of adaptation with quantitative finding, and then using our lens now that we have of thinking through, using our template, like what could we do to learn more about the impact here of this adaptation they note in the bullet point. Okay, so I'm going to finish up here a couple more slides. The last, and maybe this should be the first, recommendation is really to consider the available data and the goals of the adaptation study when selecting the most appropriate analytical approaches. So, of course, collaborating with our methodologists and our statisticians to design a statistical plan. I always get a reality check when I meet with our team statistician and I'm interested in analysis, especially analyzing adaptation. And sometimes I think it would be helpful to talk to him in the very beginning about what I'm doing and the data I'm collecting and what we can actually analyze in terms of a quantitative assessment. So thinking about bringing those people in early on. And then more and more thinking of using inferential statistics that allow for hypothesis testing. We have a lot of descriptive work on adaptations and just thinking more about how can we start testing hypotheses using our inferential statistics. And then, of course, this complex issue of considering the exposure to adaptation. So what are we actually talking about? What's the scope and frequency of adaptations at the individual, provider, organizational level? How are people exposed to the adaptation? Where does this fit in terms of your analysis? And so summary of our methodological recommendations for assessing impact. Hope you read the paper, and there's even more detail in there that kind of walks you through each of these recommendations. I think as we have time, about hopefully 10 minutes for discussion, also thinking through if you were going to attend a workshop like this AI-generated workshop we have here with our title, our methodological workshop, if you're going to come to a workshop like this, what are some things you'd really like to know about that would help us with advance the science we're doing, things you'd like to learn around assessing the impact of adaptation outcomes? So with that, I will stop sharing my slides.
Thanks so much, Kelly. That was fantastic. So much to unpack here. And let me try to facilitate the discussion, maybe be brief about each of the issues so we save time also for recommendations about your workshop, or maybe people could start just putting in chat their recommendations about workshop. I just have to take one more minute just to say how much to me your example of In Shape was like the perfect example, the best example I've ever seen, actually, in terms of what was intended and driven a more traditional fidelity thing. It's going to be fidelity. And it reminded me so much happens of Brian Mittman's early, who's done, those of you that aren't aware, some of the earliest work in here and his kind of framing. Early work, he says, adaptations always happen, whether you try to suppress them, whether you ignore them, whether you pretend they aren't there and write them up, but that they happen. And it's so important to learn to go forward to think about and document them. Um, let's see. One of the key issues, I think we had a few questions around here, was trying to clarify a little bit an adaptation form versus function. I think not everybody's totally familiar. So if you could maybe address that.
Sure. So I think the way that we think about a function is you adapt. Your function is your purpose of your intervention. What are you trying to achieve? What are the main goals of the intervention? So if we take the example of In Shape, the function is to reduce cardiovascular risk through weight loss and fitness in this population and people with serious mental illness. That is the function. We're not changing that. That is what we're trying to do. And then the forms that could take, and the adaptation we found, for example, as part of Fidelity, the model developers said it's really important that you do that in an integrated fitness facility. That happens at the YMCA or that happens at the Planet Fitness. Like people can't be exercising, meeting with their health mentors in an area that's isolated where they're not integrated. That was the form. But the mental health agencies who changed that said, well, we're in rural areas. We don't have a YMCA, or we're in an urban area. And it's really hard for people to get, by the time they get transportation, it's over. The health mentor, they missed the session. The health mentor had to move on to another client. So we've adapted that. And we have, for example, brought in fitness equipment into our mental health center. So when they come to see the therapist, they can join the health mentor and they can exercise. That's an example. The function didn't change. The health mentor's still trying to help that person improve their fitness and weight loss. The function didn't change, but the form did. So they're doing things differently. And I think Monica Perez Yolis, she has she's done a lot of thinking in this area. And if you look at her Colorado on the website, maybe we could put that in the chat. She has a worksheet and can help us do this systematic thinking of when you have an intervention, how do you identify the function versus form. So check that out if you're interested in really thinking through that with your intervention.
Well, thank you. And checks in the mail for the little plug on our Monica's adaptation on our function and form on our website. Another key or common one, I think, was talking about the question about the issue of proximal versus distal outcomes and anticipated impact. I think the question was specifically about mechanism, but the general issue about is some examples where you think the proximal versus the distal impact might be different, but particularly on mechanisms.
Where proximal might be different?
From the distal, the outcomes. Thinking
Well,
back to our table, it came up when you had our
yeah,
table.
yeah, 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 yeah. I understand the question. So I guess, if you take a clinical outcome, maybe an adaptation can help someone with their symptoms.
Mhm.
And then a distal outcome could be more like a disease reduction or something more, you have a symptom, but they still have, for example, depression, but you're treating symptoms with your adaptation. That may be, and then longer term is to hopefully have a bigger impact on depression diagnosis or something. That's a good example, I think, of a clinical. And then an adaptation or an implementation outcome, you might just think of an example of like adoption might be a more proximal example to then reach. You need someone in to adopt, like you're making an adaptation so a clinic just agrees to take on and to participate in delivering this intervention. And you need to get there first before then the distal outcome is like, then you're trying to reach more people who you want to reach with your intervention. And then,
Great.
yeah.
Oh, go ahead.
Well, just the mechanism, that's taking us back to thinking through then what's driving that change. So what's driving that change in adoption, right? So if you're trying to draw a line between an adaptation and adoption, why would your adaptation, does it change beliefs? Is it change the efficacy of the providers? Are you adapting something so they feel more confident in taking it on and delivering it? Thinking through, there might be something that you're targeting, you're reaching before it even gets to the outcome.
Okay, to getting towards the top of the hour, I want to both see if Borsika has a key issue she's come up with there, and then also see if anybody has a brief, compelling thing they'd like to shout out about workshop ideas, or again, if not, put those in the chat so we can share those with Kelly. But given what you've heard here, what if you wanted to do a deeper dive or somebody come in, what about this approach, these tables and things would be most useful to you in a workshop? Please, again, if you have a key thing, shout it out. If not, put it into chat. And then I'll let maybe Borsika kind of wrap it up and have last word here.
Yeah, thank you so much. I realized there were many questions and there is more interest, but we are running to the end of the hour, and I learned that better wrap up on time instead of everyone needing to run. But thank you so much, Kelly. Kelly, I will leave everyone with one idea that I would like us to all mull over, and I don't think we have the answer. I don't think that every single adaptation needs to be assessed for impact. Some adaptations are very practical and all that. So I think that as we think about your first part of your presentation of, what adaptation impact you can expect, sometimes it's not necessarily one that you want to assess. And so just kind of to even dramatically make it harder. But I just wanted to say, I'm so excited that we are thinking about this. And I know that your work will continue advancing it. Everyone else, please come back for Monica's presentation in February, where she will talk more about functions and forms. And thank you so much for being part of this group. It's really wonderful to have 10 years together and hopefully many more. So thank you. Thank you so much, Kelly. Thank you, Russ and Kara.
Yeah,
Yeah, thank you all.
fantastic. Thanks. Thanks. This was just great. Right on target. And again, nice 10-year celebration. So take care, everybody.
Yeah, thank you for the opportunity.
Thank you.